Good day, everyone, especially to our clinical instructor, Sir Jeff. On behalf of Group 18, we would like to welcome you for our presentation to our simulation for vehicular accident. So sit back and relax.
Vehicular accident. Abstract. Road traffic accidents, according to the World Health Organizations, are one of the leading causes of mortality globally, claiming nearly 1.3 million lives each year. According to data from the Philippine National Police Highway Patrol Group, there were 15,572 road accidents in the Philippines in 2014, with 1,252 people killed and 9,347 injured. A comprehensive study was conducted with the goal of determining which factors associated with the severity of road traffic accidents are significant with the levels of severity, which factors are significant per level of severity, and which human factors associated with the occurrence of road traffic accidents are significant with the levels of severity. Because it considers the heterogeneity of the variables and the different time varying and time dependent constraints that are not considered by other regression techniques used in road traffic accident severity literature. The Markov chain switching approach is able to determine the probability of occurrence of road traffic accidents and the significant factors that affect the severity of a road traffic accident. Introduction. Road traffic is one of the most common causes of death worldwide. In 2013, approximately 1.24 million people died from road traffic accidents. Road traffic accidents are the only cause of death that is not associated with any human diseases. The Philippines claimed ninth spot on the list of the World Health Organization's top 10 causes of death. According to a statistic from the Metropolitan Manila Development Authority, there were 82,757 road accidents in Metro Manila alone, with an average of 227 incidents each day. There were 412 fatalities, with the majority of the victims being pedestrians. According to the Department of Health's annual status report, vehicle accidents were the fourth leading cause of mortality in the country in 2013. This is the sole cause of death that is unrelated to health. So, what is vehicular accident? Vehicular accident include car crashes, truck wreck, and motorcycle crashes. Regardless of the type of motor vehicle involved, an accident victim has a legal right to pursue compensation from anyone who has at fault. What causes vehicular accident? Drivers, overspeeding, rash driving, violation of rules, failure to understand size, fatigue, alcohol. For pedestrian, carelessness, illiteracy, crossing at wrong places, moving on carriageway, and jaywalkers. How do you respond to a vehicular accident? What to do after a car accident? Check yourself for injuries. If you're injured, call 911 or ask someone else to do so. Check on the well being of your passengers, get to safety, call 911, wait for help, exchange information, document the accident, notify your insurer, and start the claims process. Dudung, Daday, and Diding were each riding a bicycle and trying to cross the highway intersection when suddenly, out of nowhere, a car hits them. The first scenario is our most prioritized patient, which is patient C, a 26-year-old female who is brought through as a stretcher who has a respiratory rate of 29 cpm with a pulse of 50 beats per minute, BP of 80 over 50 mmHg, temperature of 36.1 degrees Celsius. Upon assessment, it was noticed that her eye opening is through pain stimulation. The verbal response is with incomprehensible words. The motor response is flexion withdrawal from pain. She has no visible wound but has bruising on her abdomen. The nurse is assessing the GES, the eye opening, verbal response, and motor response.
Ma'am, unsa pangalan nato, ma'am?
Ako si Diding.
Edad nimo, ma'am, o birthday, kabalo ka, ma'am?
Akong edad kay 26. January 1, 1996 akong birthday.
Ah, nya, ma'am, kabalo ka asa ta karon, ma'am? O sa ta nga tuig karon?
Wala ko ballooners. Ang asa ko karon.
So, ma'am, naa ka karon diri sa hospital, ma'am, kay gikan ka na disgrasya ug amo kang ginatabang karon, ma'am, para para maayo ka, ma'am. So, ma'am, na ba kay madungog sa imong palibot, ma'am?
Wala kay ko ano nurse, wala ko madungog.
So, ma'am, kung nalang ko i-instruct mo kung unsa akong iingon, ma'am, buhata lang, ma'am, ha? So, na kay madungog, ma'am?
Hinay kaayo nurse.
Okay, ma'am. So, ma'am, itaas daw ang imuhang tiil, ma'am.
Aray. Aray. Dili kaayo nurse, medyo sakit siya.
Imong kamot, ma'am.
Dili pud kaayo nurse, sakit jud siya.
Sige, ma'am. Relax na dra, ma'am, ha? Tawagon sa akong doktor.
Opo.
The second scenario is patient P, a 24-year-old female who is brought through a stretcher due to a laceration in the inguinal area with severe bleeding, who upon assessment has no respiratory rate and upon positioning of airway still has no respiration, with non-palpable pulse and inconclusive non-palpable blood pressure.
Patient P has no pulse and no breathing. Code blue! Code blue!
Nurse 1 and 2 assessing and performing CPR to patient Daday.
Sir, ikaw ba tong kauban sa patient? Unsay mga nahitabo sa ilaha, sir?
Wala ko naapil og kabangga kay hinay man ko mupidal mautong naiwit ko sa ila. Dito ko og adiyot kay gitan-aw akong ligid paghangad nako mao gyud pagkabangga sa sakinan sa ilang tulo kay gusto nila mo labang sa intersection sa highway.
The doctor went back to the triage area because the patient cannot revive anymore.
Um, I'm of that 7:30 a.m. Sir, kanang gibuhat mo amo ang best, sir. Amo ang gibuhat ang amo ang kaya na pwede namong buhaton sa imuhang amigo, sir. Pero sadly, wala na jud namo natabang ang imuhang kauban, sir.
The third scenario is a released prioritized patient, which is patient A, a 25-year-old male, is carried through a stretcher and is conscious and awake. Coherent and is screaming in severe pain due to a massive abrasion on the left upper and lower extremities with vital signs of BP 150 over 100 mmHg, RR of 26 cpm, temperature of 37.6 degrees Celsius, heart rate of 120 beats per minute, with a pain scale of 9 over 10. Grimace's face was noted with verbalization.
Nurse, sakit kayo kung kamutog tiil ba? Tabangin ko ninyo.
Unsa siya klase nga sakit, sir? I-rate daw, sir, kung pila, 1 from 1 to 10. Mura ba ginatusok, sir? Mura ba siya ganaga-itik? Kaya lang ba ang sakit? Makaliw pa ba ka, sir?
Ano nurse, nasa mga se- 7 ma'am, dahil murag siya nagpitik-pitik ang akong kamutog tiil ma'am.
Okay, okay. Sige, sige, sir. Nagasigi-sige ba ang sakit or nagawala-wala siya?
Ano nurse nga nang sige-sige yung sakit ma'am niya. Say ang ibuhaton nako ni ma'am.
So, sir, una na to buhaton, kay mo relax sa ta. Unya, hinahinay laglihok imong kamot ug tiil na may mga samad para makatabang pampakalma sa gibati ni mga sakit. Sir, mangutana ko ba na ba kay mga allergies sa mga tambal para mahatagan ka na mo pain medication. Ina na to si doc tapos sir, limpihon ako imong samad ha para dili magka-infection hapdos pud biya ni sir ingon lang og sakit para mahinahinay na kog butang ha. So for the explanation of the nursing interventions, first is to provide measures to relieve pain before it becomes severe. So it is preferable to provide an analgesic before the onset of pain or before it becomes severe when a larger dose may be required. So example ani is preemptive analgesia, which is administering analgesics before surgery to decrease or ma-relieve ang pain after the surgery. The preemptive approach is also useful siya before mag-painful procedures like wound dressing changes, physical therapy, the postural drainage, and etc. So, ikaduha nga nursing intervention is we acknowledge and accept the client's pain. So, mga nurses have the duty to ask their clients about their pain and believe the reports of pain. So, challenging or undermining their pain results in an unhealthy therapeutic relationship that may hinder pain management and deteriorate rapport. So the third intervention is to provide cutaneous stimulation or physical intervention. First is to apply heat and cold applications. So cold works by reducing pain, inflammation, and spasticity by decreasing the release of pain-inducing chemicals and slowing the conduction of pain impulses. Cold is best when applied kanang first to 24 hours of injury, while heat is used para treat na to ang chronic phase of an injury by improving blood flow to the area and through reduction of pain reflexes. Second is to immobilization. Mag-restrict ang movement of a painful body part sa patient is another non-pharmacologic pain management as well. So, buhat to do this, no, kay we need a splints or supportive devices para ma-hold sa joints in the position optimal for function. Mag-note lang tanan na prolonged immobilization can result in muscle atrophy, joint contracture, and cardiovascular problems. So, before that, kay mag-check sa tauna sa mga agency protocol.
At 9 a.m., the fourth scenario is all about patient C, who has been absent of breathing and pulse.
Good morning, ma'am. Mag-check lang po sa imong vital signs, ma'am, ha? Ma'am? Ma'am? Ma'am! Patient has no pulse and breathing. Code blue! Code blue!
The code blue, the emergency response system is called. Nurse 1 and 2 performing CPR, insert IV with gauge 18 and run plain LR 1 liter fast drip 500 ml for 30 minutes, then regulate at 120 cc per hour with a drop factor of 20 drops per minute. Attach to AED, assess for shockable rhythm, give shock, insert endotracheal intubation size 7 at 21 level, give one breath every 6 seconds.
Nurse,
Training mode. Call for help.
Medication enterprise IVCP.
Plug in pads connector. Apply pads to patient's bare chest as shown. Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stand clear. Press flashing shock button. Shock 1 delivered. It is safe to touch the patient. Begin CPR now.
Upon performing CPR, one of the nurses insert IV with gauge 18 and run plain LR, 1 liter fast tube 500 ml for 30 minutes, then regulate at 120 cc per hour with a drop factor of 20 drops per minute. Attach to AED, assess for shockable rhythm, then give shock, insert endotracheal intubation, size 7 at 21 level, give 1 breath every 6 seconds. Upon giving IV insertion, the physician ordered medications such as epinephrine, IVTT 1 ml diluted in 9 ml of plain SSS every 3 to 5 minutes. Amiodarone IVTT, first dose 300 mg bolus, then second dose 150 milligrams. Lidocaine IVTT, first dose 101.5 per milligram, then second dose 0.5 to 0.75 per milligram.
So the patient has been revived. CPR helps keep oxygenated blood flowing to the brain and other crucial organs until normal heart rhythm is restored. This is the core reason why investing your time in CPR training is extremely beneficial. Cardiopulmonary resuscitation, better known as CPR, should be everyone's base emergency training. The patient has an absence of pulse and breathing, that's why CPR is performed, followed by AED, or automated external defibrillator, which is used to help those experiencing sudden cardiac arrest, and it's a sophisticated yet easy to use medical device that can analyze the heart's rhythm and, if necessary, deliver an electric shock or defibrillation to help the heart reestablish an effective rhythm. And the tracheal tube was inserted to keep the airway open in order to give oxygen, medicine, or anesthesia. Support breathing in certain illnesses, such as collapsed lung or severe trauma because patient C was in a vehicular accident, and the tracheal tube removes blockage from the airway. Epinephrine was given because it acts quickly to improve breathing, stimulate the heart, and raise a dropping blood pressure, reverse hives, and reduce swelling of the face, lips, and throat. Amiodarone was also given because it is a potent antiarrhythmic agent that is used to treat ventricular arrhythmias and atrial fibrillation. The drug prevents the recurrence of life-threatening ventricular arrhythmias and produces a modest reduction of sudden deaths in high-risk patients. Lastly, the lidocaine was given too because it is an anesthetic. It causes loss of feeling in the skin and surrounding tissues. It is used to prevent and to treat pain from some procedures. This medicine is also used to treat minor burns, scrapes, and insect bites.
Fast forward to 9:30 a.m. The fifth scenario, patient shows signs of return of spontaneous circulation. At 9:40 a.m., in the sixth scenario, the doctor ordered attached to mechanical ventilator, AC mode, FiO2 40%, PEP 5, tidal volume of 40-50, tidal volume of 450 ml, RR12, suction secretion as needed, with NGT French 14, with Foley catheter attached to Eurobag, draining yellow-orange urine at 200 ml. IVF to follow, plain LR at 120 cc per hour for transfer to the ICU. The patient has also pending labs, still for stat chest x-ray, still for stat CT scan of the whole abdomen, still to secure 2 units whole blood, then cross-match request with watcher.
Yang done na ako magbigay ng assessment kay patient ba. So, if meron concern si patient, ay please lang na i-relay mo agad sa akin. Tapos, i-take note mo lang kung merong mga danger signs kay patient ha.
Okay po, Doc. I will do the nurse intervention to the patient na po, Doc.
Thank you so
Thank you po. So, for the explanation, the patient C was attached with a mechanical ventilator, which is a machine that helps the patient breathe when he or she is sick, injured, or sedated for an operation. It pumps oxygen-rich air into your lungs. It also helps you breathe out carbon dioxide, a harmful waste gas your body needs to get rid of. FiO2 is defined as the concentration of oxygen that a person inhales. Positive air expiratory pressure, or PEP, is the positive pressure that will remain in the airways at the end of the respiratory cycle that is greater than the atmospheric pressure in mechanically ventilated patients. Tidal volume is essentially every breath a person takes. It is one of the main determinants of minute ventilation and alveolar ventilation. Minute ventilation, also known as total ventilation, is a measurement of the amount of air that enters the lungs per minute. It is the product of respiratory rate and tidal volume. The purpose of oral suctioning is to maintain a patent airway and improve oxygenation by removing mucous secretions and foreign material from the mouth and throat. A nasogastric tube, or NGT tube, is a special tube that carries food and medicine to the stomach through the nose. It can be used for all feedings or for giving a person extra calories. Learn to take a good care of the tubing in the skin around the nostrils so that the skin doesn't get irritated. A Foley catheter is a common type of indwelling catheter. It has a stop, plastic or rubber tube that is inserted into the bladder to drain the urine. In most cases, the provider will use the smallest catheter that is appropriate. Patient C was transferred to ICU because the main aim in all such transfers is maintaining a continuity of medical care. As the transfer of sick patient may induce various physiological alterations which may adversely affect the prognosis of the patient, it should be initiated systematically and according to the evidence-based guidelines.
So next is health teaching.
Hi, Doc. So far, okay naman po ang vital signs sa akong patient. Ug wala man ko'y laing nakita nga complication og napansin sa iya ha throughout my assessment, Doc.
Thank you, nurse. Please na lang ko og hatag sa mga health teachings nga dapat ihatag kay patient ha. And then also, please lang pud ko og explain kay patient katong mga medications na gipanghatag sa iya ha. And also sa mga dapat ipang-avoid o mga dapat niya buhaton para dili na pod mag-worsen ang iyahang case.
Sige,
Tapos,
Doc.
nurse, please na po ko og relay og mga informations na imuhang mag-gather kay patient ha. Tapos, i-note lang siya sa cloud.
Sige, Doc. Copy, Doc.
Thank
So,
you.
okay po. Hi, ma'am. So, gikan naman diri ang doktor, ma'am, no? O tong na disgrasya ka, ma'am, gi-check dayon sa doktor. So, tungod sa imong disgrasya, ma'am, maka-feel ka og mga sakit sa imong lawas, labi na sa imong mga samad. So, sa mga sunod nga adlaw mo basi magsakit pa jud na grabe ang imong samad kay magmulmul man jud na siya, ma'am, labi nagnakay mga gas-gas. So, gi-check naman ka sa doktor ganina, ma'am. So, if naay mga basi naay mga problems nga ma-develop later, ma'am, or after ma-discharge ka, ma'am, magtawag lang dayon sa imuhang doctor, ma'am, kay para ma-treat ka dayon, ma'am. So, if maka-feel po ka kanang naay mga bago nga symptoms gud, ma'am, if ever maggrabe sakit imong ulo or kanang magsuka ka, kang dili gyud siya usual, ma'am, tawag lang dayon, ma'am, kay para ma-appoint dayon ka o matambalan dayon ka, ma'am. So, i-be sure lang pud, ma'am, nga mag-adto ka sa tanan appointment nimo, ma'am, para maghapon na sa imong safety, ma'am, ug para mapadali imong pag-ayo. So, mas nindot pud, ma'am, if kabalo ka sa mga results sa imong lab test, ug i-keep lang ang mga medications nga gipanghatag sa doktor sa imong, ma'am, kay basig pangitaon niya if na siya i-add nga i-add nga kanang medication, dito lang niya isulat og iwas. Kasabot ka, ma'am?
Okay po, ma'am. Thank you kayo, ma'am. Ka nang ma'am, naalam ko'y pangutana ba? Unsa mga klase nga pag-care sa akong kaugalingon akong dapat himuon, ma'am?
So first, ma'am, ang pinaka-importante is bantayan jud nimo ang mga changes sa imong kaugalingon, ma'am. Like kanang mga unusual. Dahay kung dili ka weak itong dati, nya karon kay wala pa man kakabatig luya kaayo. So if after sa discharge mo, ma'am, if kanang maka-feel ka kanang luya kay ka, ma'am, um, itawag mo sa doctor, ma'am. Nya pag maka-experience kag sakit sa ulo, ma'am, mao po lang time na magtawag ko sa imong doctor, ma'am. Tapos sunod, ma'am, ayaw kayo biglaay mo hang lawas, ma'am, makanang ka, ma'am, magtrabaho sa imong mga sa inyong balay. Kailangan mo dyan mo mag-take of rest, ma'am, kay para mas fast ang healing process, ma'am. So sa imong mga ma'am, sa imong mga bunog, ma'am, ug sa mga imong hubag, sama sa imong mga samad, pagbutang na og ice, ma'am, nga dapat giputos o kanang ma'am, tela, ma'am, tapos i-apply siya 10 to 20 minutes. Tapos if maka-feel kag mga sakit, ma'am, pag nag-prescribe imong doctor og medications para sa pain, i-take lang siya dayon. Pero pag wala, tawagi lang imong doctor if maghatag ba siya or pwede ba magpalit na kag over the counter or mag-prescribe siya sa imuha. So, pag maka-take ng medication, ma'am, ayaw pag-drive, ma'am, ha? Ayaw sa jud pag-bike, ma'am, kay para di na pud ka mausban, ma'am. Isut na. Sunod, ayaw lang pud pag ma'am, ha? Kapag buhat og kanang biskang unsa nga buhatonon, labi na sa inyong balay. Kay basig ang sakit sa imong ginabati, ma'am, maglala. Nya ayaw pud pag inom og mga alcohol beverages, ma'am. Dili pala inom ba ka, ma'am?
Dili kaayo, ma'am.
Maayo, ma'am. Pero kay gainom man ka, ma'am, ayaw sa pag-inom, ma'am, ha, hangtod sa wala pa nag-ingon ang doktor nga pwede na ka mainom. Okay ba, ma'am?
Okay po, ma'am. Sige po. Ma'am, ma'am, if ever na ako mga batiin, ma'am ba, unsa akong mga angay buhaton, ma'am?
Ang pinaka-importante nga buhaton nimo, ma'am, is tawagan jud nimo imong doktor, ma'am. So pag hatagan ta kag mga symptoms, ma'am, nga usual nga ma-feel nimo pag after sa pagkadisgrasya, ma'am. So pag maka-feel kag sakit sa imong ma'am, tiyan, or baka maglisod kag ginawa, or nakay ka na magluya or maka-feel kag numbness sa imong lawas, tapos kanang ka, ma'am, magsige kag suka, nya kalang grabeng sakit sa imong ulo, mo jud na ang time nga magtawag ka sa imong doktor. Tapos mo to, ma'am, kailangan jud mo bantayan imong kaugalingon if naba jud mga naba jud mga changes sa imuha, labi na kanang gikan kag disgrasya. So mao to, ma'am, if ma'am, if feel nimo, ma'am, nga dili pud ka kanang wala ka na ayo pag after sa imong discharge, ma'am, kanang maggalala imong sakit, tawag po sa imong doctor, ma'am. Nasabtan ba, ma'am?
Salamat, nurse.
Sige, ma'am, salamat. Amping kanunay.
Fast forward so end of shift. After thorough assessment, Nurse 1 was giving health teaching to patient C. The nurse assigned to patient C had already ended her shift, and then she began to endorse the two patients rather, to charge nurse.
Hello, good morning. Endorsement na po tayo. Total census of the patient is 5, trans in 2, trans out 0. So, first endorsement kay si patient C, D being 26-year-old female under the service of Dr. Galicia, which is brought to a structure. So, the RR of 29 CPM with a pulse rate of 50 BPM, BP of 80 over 50, temperature of 36.1. Tapos, ano ni siya, kanang naka fully cut ni siya, no? Tapos, insert IV with G18, gauge 18 and run. Place as 1 past 3, 500 milligram for 30 minutes. Then regulate at 120 cc per hour with the drop factor of 20 drops per minute. So, attached to ED ni siya, no? Tapos, mag-insert ta og endotracheal intubation size 7 at 21 level. Tapos, for the medication niya kay epinephrine IVTT, 1 milliliter dilute 9 ml of plain NSS every 3 to 5 minutes. Amiodarone IVTT, first dose at 300 milligram bolus, then second dose 150 milligram. Then sa Lido, kay kuan IVTT, first dose 100 pa 1.5, then second dose niya is 0.5 to 0.75 kilograms. Upon the assessment kani si patient si kay nag-ay ayang ay po ni kay ay opening niya kay throat pain simulation lang jud, no, tapos yang verbal response lang kay is incomprehensible, di siya makastoryag tarong. Tapos yung motor response is flexion with and withdrawal from pain. Tapos na siya no visible wound pero na siya bruises yung abdomen. Still for stat chest X-ray, still for stat CT scan of the whole abdomen, still to secure you 2 units whole blood then cross match with the request sa watcher. Yan, tapos sayang ano, nabot naman dayang ano laboratory result. Ang CBC niya is WBC 14,000, medyo taas siya. Yang neutrophil kay 64, lymphocytes niya is 30, hemoglobin 10.0, hematocrit 30.2, red blood cell 3.0, RBC distribution with 10.0. Tapos yung basic metabolic panel kay murag ang taas yang ano BUN no kay 25, then creatinine niya is 1.4. The rest kay normal range lang. And then next patient na to kay si patient A, Dodong, 25 years old male, under the service of Dr. Galicia, carried to a stretcher and is conscious and awake. Then, nag-chief complaint of severe pain due to a massive abrasion on the left upper and lower extremities with pain scale of 9 over 10. Latest vital signs niya is BP 150 over 100 milligram, RR 26 CPM, temp niya is 37.6, then HR niya is 120 BPM, then nag-grimace face was noted with verbalization na sakit kayo, akong kamot ug tiil, tabangi ko ninyo. So, ano na siya, no, pending labs po na siya kay patient A, then ano na siya, kanang, so, murag, walay, wala siya pending labs. Okay. For kuha na siya, continue management lang ni siya kay patient A. And then, pending labs, still for chest x-ray po ni siya, no? And still for CT scan po ni siya, the whole abdomen inside. That would be all for the endorsement po.
Guys, on cam.
So that's it for our vehicular simulation. We hope that we followed all the guidelines and all the instructions that were given to us, despite of many difficulties, like for example, slow internet connections and many um, slang words na na-pronounce sa mga narrator and also sa mga characters. And